My name's Dr. Hamilton Ayres. I'm one of the doctors who checks skin at National Skin Cancer Centres, and I thought I'd talk to you about what's involved in the process if you've never had a skin check before. It's not particularly complicated. I generally let people keep their bra and undies on. There's a towel of modesty that they can wrap around themselves. Ultimately, they sit or lie on a relatively comfortable bed with some warm air conditioning or cool air conditioning, depending on the weather, and with a bright light and some magnification and a little bit of technology to capture any interesting images of spots that are a bit suspicious. A systematic assessment of your skin takes place. My particular method is pretty much the same as everyone else's. It involves checking, for starters, a little rifle through the scalp. Sometimes people get things in their part line. Then an assessment of the face. A lot of sun gets on the face. Skin cancers on the driver's side temple, driver's side nose are pretty common. Have a close look there. Then have a look around the neck, the V neck. Not a lot escapes there. It's a very sun-exposed part of the body. Then I have a look at both arms, and certainly most of the time would get spent looking at the head, the neck and the arms in the first few minutes, because that's where a lot of people get too much sun. Of course, you can get a melanoma anywhere, which is really unfortunate. In Australia, probably the vast majority are related to sun exposure, but then we systematically have a look through the abdomen, the chest, the legs, the shins, the toes while you're lying on your back. And then, if nothing's been found, you turn over on your tummy, have a look at the soles of the feet between the toes, the calves, have a look at your back, see if anything's worrying you. You stop growing moles after age 40. And it's nice to have the baseline photos of what you used to look like, just in case one day, at your yearly skin check, something looks out of place. We've certainly then got those images to compare to. If something looks really out of place, look, the usual next step is biopsy. Sometimes it's just the story that's a bit concerning, whereas the doctor might not be all that worried about how it looks, but the story's concerning. In that case, you might take a photograph and recheck the image if the spot was flat about 3 months later and put them side by side, compare it. If there's any change, then you're probably going to get a small biopsy. It's just the safe way to do things.